So I'm going to move on to the last part of this round, and it's what we are calling the 15-30 volley. And in this, each side gets the formal opportunity to put a challenge or a question to the other side, showing why they're right and why their opponents are very wrong. They get 15 seconds to make their point. Their opponents get 30 seconds to respond, and then there's a 15-second rebuttal, and then we'll switch it and do the whole thing to the other side. At the end of each of these time periods, 15 and 30 seconds, I'm going to ring a bell. That means you have to stop talking. So I'm going to start with this team, the team arguing for the motion. Either of you can go. In 15 seconds, what do you have to say right now to the other side? Your 15 seconds starts now.
How are we going to actually reduce drug costs, given the fact that they are high, they have gone up substantially in the last few years, and we have more specialty drugs coming out where the prices are 20, 30% higher?
Go ahead. Look, get the government out of the way. There is something called Medicaid best price that limits the ability of insurers and companies to come together and say, hey, pay for performance. We're going to save you money. We're going to improve that patient's health. And that puts the onus on the drug manufacturer to perform and lowers the barriers facing patients.
Oh, you didn't use all your time. 15 seconds to respond to what you just heard from them. Are you convinced?
Well, look, no, I'm not convinced, because there's no indication that drug companies are actually lowering the opening price. And they keep, when they have a drug out there, they keep raising the price over and over again. It's not clear at all that they're going to be willing to give in to prices. As a matter of fact, only when they're forced to lower prices.
All right, your side now gets to put, what do you want to say to the other side?
I would say there seems to be an assumption from the other side that any time spending on medicines goes up, it's automatically a bad thing. But if spending goes up because we're curing disease and we're bringing new breakthrough treatments, that doesn't seem like a bad thing to me, particularly if these medicines can prevent the need to use other more costly healthcare services. But it seems like from your side, that seems like a bad thing.
We're agreed that if the drug is curative, if the drug decreases side effects or saves money in the system, that's a good thing. The problem is we have these super high drug prices, $150,000, $300,000 drugs that don't cure anyone, and they're still exorbitantly expensive. And that makes it difficult for people to actually take the drugs and be healthy.
Yeah,
and
I think we'd all agree, and maybe we could all agree as a group, we definitely want more high value in the system. We definitely want drugs that work that
15
benefit
seconds to
people.
respond.
Look, you want the iPhone. You don't want the first cell phone. There's going to be incremental improvements. There are going to be things that are not perfect cures, and you want to pay for them too. Right? You want people to have advantages and get better. You're not going to say to them, wait until there's a cure, and until then we're not going to treat you.
Time is up. That concludes this round, and it concludes round 2 of this Intelligence Squared U.S. debate, where our motion is blame Big Pharma for out-of-control healthcare costs.